We are starting our 19th weekend, and today is our 37th class in quantum psychotherapy. And the topic today is incorporating quantum psychotherapy into established traditional therapies. As we end this course on quantum psychotherapy, we come from diverse disciplines, most of which still teach and work using Newtonian physical world approach to life and living. So how will we incorporate that dimension of energy that looks at what's happening at the subatomic level of the quantum world to include quantum psychotherapy in our usual practice? Integrating quantum psychotherapy into traditional counseling involves shifting from a pure talk-based linear model to one that views the client as an energetic energy field that is dynamic. So by combining standard psychological frameworks with principles of quantum physics like entanglement and non-locality, you as the therapist, whether you are a CBT therapist or psychoanalytic therapist, you can address trauma at an energetic level rather than just a cognitive one. So merging these disciplines creates a bio-psycho-spiritual approach. Bio-psycho-spiritual approach. And it acknowledges the validity of traditional diagnostic tools while utilizing energy work to accelerate release and deep-seated emotional patterns. So a holistic form of healing treatment where we heal and treat a client not just as a mind to be fixed, but as a quantum system capable of instantaneous transformation. So we are shifting the paradigm from mechanic to energetic. And traditional counseling operates on a Newtonian cause and effect model. A past event causes a present symptom, according to the Newtonian model. And quantum psychotherapy introduces the observer affects the observed. And this means that the therapist's own energetic state and intention can influence the client's healing process. So incorporating this requires the therapist to maintain a quantum presence, a state of high vibrational neutrality that allows the client's energetic stuckness to shift. So incorporating quantum psychotherapy practices into established traditional therapies, quantum psychotherapy integrates principles of quantum physics such as entanglement, superposition, observer effect with traditional psychological models to enhance the therapeutic efficacy. So by shifting the view of mental distress from purely cognitive or biological issue to energetic ones, this integrative approach seeks to address the root cause of psychological imbalances at the subatomic level of things. So let us go through the core quantum principles in therapy. We did this during our first week in quantum psychotherapy, but we are going through it again so that we can wrap it up all together. Traditional therapies often align with classical physics, where a clinician observes a patient and gathers data to solve a math equation of symptoms. And quantum practices, however, introduce fluid concepts. And the first concept is the observer effect. So in quantum physics, the act of observation changes the behavior of the particle or the phenomena being observed. And in therapy, the presence of an attuned, compassionate therapist acts as the observer, influencing the client's internal reality and potential for growth. Another principle is superposition. And this principle suggests that particles exist in multiple states simultaneously. And in cognitive restructuring, therapists use this to help clients hold multiple alternative perspectives at once, breaking the rigid, limiting belief patterns. And the third principle is entanglement and non-locality. Quantum theory posits that particles can be interconnected regardless of distance, and a change in one particle elicits a change in the other particle, and one particle will be aware of what is happening in the other particle despite distance. And once the two particles are linked, they remain connected forever. So applied to therapy, this emphasizes the interconnectedness of mind, body, and the broader social ecosystem rather than viewing the individual in isolation. If we were to know that we are connected to everything at all times, faster than the speed of light, wouldn't our healing be faster? So how do we integrate all this with traditional models? Established models can be quantum invigorated by incorporating holistic and energetic-based techniques. For example, quantum enhanced CBT. We looked at it during one of our lessons, and trauma somatic practices and analytical psychology. So when we look at quantum enhanced CBT, here, traditional cognitive behavior therapy, CBT, can be integrated with quantum principles to address both cognitive patterns and energetic fields. And techniques like biofeedback and neurological monitoring help the users to visualize and modify their internal states in real time. So this is where we use meditation. This is where we use visualization. This is where we use breath work in conjunction with traditional cognitive behavior therapy. And when we come to trauma and somatic practices, from a quantum perspective, trauma is stored as stuck energy within the body cells. So practices like somatic experiencing, breath work are used to release these energetic imprints, complementing traditional talk therapy. And when we look at analytical psychology, researchers have used methodologies to bridge the gap between quantum physics and Jungian analytical psychology, using quantum metaphors to explain the felt sense of well-being and purpose. So you don't have to give up your traditional way of using things. See how you can incorporate some principles of quantum psychotherapy. So collapsing the waveform of trauma in quantum terms A traumatic memory exists as a wave of infinite possibilities until it is observed and collapsed into a fixed narrative. And in traditional CBT or psychodynamic work, these are identified as narratives. And energy work such as tapping or Reiki goes a step further. It targets the aura where the emotional charge of trauma is stored. And by addressing the physical sensation, that energy, while discussing the memory, the therapist helps the clients to recode the quantum information, collapsing the old traumatic waveform and opening up new emotional possibilities. When we look at non-locality and the therapeutic alliance, and how we can incorporate this into our traditional therapies, quantum entanglement suggests that once two particles interact, they remain connected across distance, space, and time. And in a therapeutic setting, the quantum bond between the therapist and the client allows for empathic resonance. And traditional therapists can use this by using somatic tracking, sensing the client's energetic shifts in their own body. And this bypasses the limitations of language, allowing the therapist to guide the client towards unlocalized healing that isn't tethered to linear time. And that's where quantum jumping comes in and spontaneous remissions of symptoms. So, when we look at somatic tracking, which is a mindfulness designed technique that retrains the brain to interpret bodily sensations as safe rather than threatening. And it's designed to break the pain-fear cycle by teaching the nervous system that uncomfortable sensations like chronic pain and anxiety or tension are often false alarms rather than signs of acute tissue damage. And this practice of somatic tracking takes 2 to 3 minutes and can be repeated several times a day. And it is best practiced when symptoms are at a low to medium intensity so that you can maintain a sense of safety while observing them. So settle and ground. Find a quiet space and get into a comfortable position. And you can do this sitting or lying down. And take a few deep, slow breaths to signal to your nervous system that you aren't in immediate danger. Observe with curiosity. Shift attention to physical sensation. Instead of fixing or escaping it, observe it objectively without judging it. See it as if looking at a curious object in a museum. Then you can label the details. Is the pain sharp? Is the pain dull? Is the pain pulsing? Or is the pain warm? Track the movement of that sensation. Does it shift? Does it expand? Or does it fade as you watch it? Remember, you are observing with curiosity. Then reappraise for safety. Observe silently or aloud. Remind your brain that these sensations of sharpness, these sensations of warmth or pulsing are safe. And you can simply say to yourself, this is just my brain misinterpreting signals. This sensation may be uncomfortable, but it is not dangerous. Then induce positive affect to further lower the threat level. Try to bring a sense of lightness or humor. Think of a pleasant memory, or focus on a part of your body that feels neutral or good, like the warmth in your hands, to balance this experience. And better still, you can smile at that anxiety. You can smile at that tension. You can smile at that pain, because smile releases endorphins that are the body's painkiller. Then maintain the outcome. Observe sensations without the goal of making it go away. And if you focus on pain with the intent to kill it, your brain remains in a threat state and it amplifies the signal. So current medicine often treats symptoms without addressing the underlying root causes of the sickness. So to pursue more effective medicine, there is a growing call for integrating quantum principles into medical science, and soul sickness is posited as a cause of illness. Can we scientifically define and study soul sickness and soul healing? Soul healing then involves the transformative of negative information within the quantum field, within our aura, into positive information, effectively addressing the root causes of sickness and difficulties. So as we end this presentation, which quantum principle, which quantum practice will you incorporate in your established traditional therapy? Enjoy your evening. See you next.